Welcome to the Elaborate Topics podcast, where we focus on lab-specific strategies for medical laboratory professionals. We're proud to be the healthcare detectives that work behind the scenes to get the results needed to influence medical decisions. Let's grow together and jump right into the lab.
Welcome back to another episode of the Elaborate Topics podcast. I'm your coach for today's show, Ms. Stephanie Whitehead, and we are here in season 2. Hopefully you guys have been keeping up with season 1 and all of our earlier episodes of season 2. And so I'm really excited for today, and I want to get right into our show. So we've got some really great information for you guys. For those of you tuning in for the first time, the Elaborate Topics podcast is a weekly podcast where myself and my co-hosts bring you topics related to the laboratory and leadership to help you excel inside and outside of the laboratory. So be sure to share this episode with all of your laboratory colleagues, like us on our LinkedIn page, and follow us on all of our social medias. You can follow me at Stephanie Y. Whitehead. And like I said, we've got a really interesting show for you guys today. And I've got a very exciting special guest, Miss Sarah Cook. Thank you for joining me today.
Hi. Thank you for having me.
No problem, no problem. Sarah, why don't you tell the guests a little bit about yourself, what you've been doing, and some highlights of your career?
Yeah, that sounds great. So right now I'm a new consultant for Pepper Foster Consulting firm in Portland, Oregon, where I work in a variety of industries. But to back up, I started my career in the laboratory doing research at Oregon Health and Science University. And then I moved into the clinical laboratory setting, starting out at the Portland VA Medical Center doing microbiology and molecular science. I currently live in Rapid City, South Dakota, where I worked my way up at the local hospital here as a microbiologist. Then I moved to being a laboratory quality and safety leader, and then a performance engineer focusing on process improvement opportunities for all areas of the healthcare system, including the laboratory. I became Lean Six Sigma Black Belt certified, and so I've been able to apply that certification in all types of work that I did in the laboratory, but also now.
Super. Why did you choose the laboratory profession in the beginning? That's a question I love to ask people, because what I find many times is many laboratorians kind of stumbled their way into the profession. Nobody kind of went straight in. We all passed by the same table at freshman orientation and in undergraduate school, and kind of stumbled our way into getting a clinical laboratory science degree. So why did you even choose the laboratory profession?
Well, in college, I was working on the side in a developmental biology lab. And when I graduated, I started out working in a behavioral neuroscience laboratory focusing in on alcohol addiction. And I knew I was not interested in working with patients in a direct care sense. So I felt like research laboratory science was really the only way I'd be able to do that work. But I also wanted to help impact patient care in some way, but I knew I didn't want to actually work with patients. And it's so true. I totally stumbled on clinical laboratory science, and I just thought, oh my gosh, I could do this work in healthcare. And it just it was totally by chance. I saw a random flyer in the hallway. And so I completed my clinical laboratory degree and started working in microbiology and molecular science. And in my experience, we end up using lean tools and techniques sometimes without realizing it. For example, in the lab, we have extensive standard work. We use policies and procedures to guide us to do the work in the same way to get the same results, right? The flip side of that is that many of us have that small notebook in our lab coats to tell us how to actually do the work in our own words. And this sometimes leads us to teach how to perform a procedure in many different ways, depending on who's doing the teaching, which can absolutely introduce variation and waste in our processes. So I was interested in standardization and removing waste, and I didn't know it yet, but I was starting to think in a lean way. And so my family moved to South Dakota, and I started out in the local hospital here doing microbiology and molecular science again, but also heavily into quality and safety. And that's really where I formally discovered lean and fell in love with the tools and concepts. And I also attended my first lab quality confab in New Orleans. And I became passionate about helping teams apply lean everywhere I could. And when I had the opportunity to become a performance engineer and practice lean and process improvement in all aspects of healthcare, I jumped at the chance. But I still wanted to stay connected to laboratory science. So I was very focused on how I could apply lean tools and techniques in the laboratory setting. And that's really how I got into it. It's totally by chance, but it led me down so many different paths that would totally change my career.
Well, I think so. You've been another person who's proven my theory. Thank you. But what you've also said is really pivotal, and it's one of the things that we've said on many episodes of our podcast, is that the background and the skills and the education that laboratory scientists learn as we're going through our schooling are really diverse skills and things that can be used in so many different arenas. And so if you are listening and you are working the bench and you feel stagnated in your daily work, then definitely reach out to Sarah, because she is another prodigy that has really been able to diversify her skills and her background with her clinical laboratory science degree. And I'm glad that you said all of that, because that's a great kind of segue into what we're talking about today, which is lean, and how you can use lean and the skills of lean to really problem solve in your life, definitely in your laboratory. I found a quote, Sarah, and it says, "There is nothing so useless as doing effectively that which should not be done at all." And that quote is by Peter Drexel. And I really feel like it's really a cornerstone, a pivotal quote for what we're going to be talking about today, which is the principles of lean, and using that to standardize daily work and your work processes, which are things that are so important in the laboratory, and how to implement those processes in your laboratory if you already don't have them implemented in your laboratory. It's a new year. It's time to try to do things a little bit differently, and try to make all of our lives a little bit more effective. So Sarah, why don't you start out by describing or really just introducing us to what are lean principles?
Right. So lean is about making processes more efficient by removing waste. And what we want to focus on is adding value, right? What is someone willing to pay for? That's really our definition of what value add is, right? So if a patient waited in a waiting room to get their lab drawn, what if we sent them a bill for waiting in the waiting room, right? That's not value added. A patient's not interested in paying for that. But we have to think about, there are some pieces of a process that are required, right? Sometimes you have to wait so people can prepare. Hopefully not, but there's some pieces of a process that are business required. That's how we define them. We certainly have processes in CAP and CLIA that they're required. We can't remove them. They have to be part of how we do our work, right? But what I also want to say is that lean is also about creating a culture of respect for the people doing the work and making it a safe place for people to share ideas for improvement. We can use lean methodology and its mindset to create that safe place for people to report errors and find solutions, and also just have that discussion about, why are we doing it this way? Could we maybe cut out these two processes and make this a more streamlined approach or workflow? And it doesn't always mean that that's going to be the outcome, but it's about facilitating that discussion and making a safe place for people to start asking those questions.
And when you look at what you've been able to do with implementing lean and working with lean processes in the laboratory, can you give us some examples of common projects that you have been able to work on? In our laboratory, I know for sure, we've been as sophisticated as using lean to help us monitor our turnaround times or look at our pre-analytical processes in terms of specimen collection with our nursing staff, our clinical staff, and really other things as easy as, my computer is at point A and then I have to walk 15 steps to the printer when I print to
Yeah.
get the thing off the printer, why don't I just move the printer beside the computer and then I eliminate all of those steps in my day? And we look at ways to organize spaces to throw away things that are not being used and use things and put more space for supplies that are more commonly used, or put supplies that are more commonly used beside the area where they're used. If I put all of my stains next to my, histology, immunohistochemistry stainer, or things like that, things that just kind of make people's day flow easier. And so what kind of
Right.
common projects have you seen people use? Many of the listeners might be leaders of a laboratory that are wondering, what are some of the things that I can implement to help my staff and help their workflow?
Right. And I would say that the laboratory, compared to so many other areas of healthcare enterprise, the laboratory is really such an ideal place to really implement these lean tools and techniques. It has so many similarities to a manufacturing environment, but also we really use those streamline approaches. And so it's such a good place to start out. And so absolutely, my biggest project requests in the lab were typically related to turnaround times. For example, many of the projects were pre-analytical processes related to stat labs, but also gram stains, blood culture organism identification, morning draw critical results, calling time for critical results. But other than turnaround time projects, there are also a lot of supply chain efforts, right? So specifically overnight order volumes or butterfly needle usage. And so we also had many cross-functional or multidisciplinary processes that were not just in the control or the scope of the lab, such as when a lab is ordered or if the lab is not collected by lab personnel, right? Whether it is by nursing or surgical procedures. So as we examine opportunities for improvement, as well, and examine who's involved upstream and downstream of the process, we want to get those people involved as well.
And earlier when you were speaking, you mentioned the term standard work. For our listeners out there, what is that and how can that improve their laboratory practices?
Right. So standard work is really just a step-by-step guide on how the work is actually being done. And so I know in the laboratory, we would have our Word document printed out and put it in a paper protector that had steps on how we would complete a gram stain, right? But things would change and we'd figure things out and things would happen and people would start writing down on the piece of paper, don't do this, do that. When it does this, do that. And this whole paper was stained and it was written all over. But what you want is just a standard step-by-step guide on how everyone is expected to navigate through the process. And it's such a valuable thing because we want to make sure that we can eliminate waste, but also remove that variation. Because when you're adding in that variation of how I might do a process compared to someone else, we might end up with a different outcome, a different result. And when we're kind of troubleshooting and saying, hey, this is going on with the process, I don't really know how what's going on with this, that's really hard to do when we're all doing it a different way. Well, where's the opportunity for improvement? Because it could be when I'm doing the process this way, but it could be when you're doing the process that way. And so if we're navigating a process in a standard way and an error occurs, it's going to be a lot easier to identify where that opportunity for improvement is if we're following that standard workflow.
Right. And when you're looking at errors and when you're looking at, okay, I have a standard process in place, but an error occurred, that's also a good place to understand where we can improve the process when you're investigating the root cause of that error. But for our listeners out there, if you're just, looking at your laboratory and saying, what are the projects that I should pick? How would you suggest an initial assessment be done? Obviously, like I said, you could look at errors, you can look at standard things like turnaround time. Certainly, CAP and CLIA have suggestions of things that laboratories should monitor. But what are some other suggestions you have on how to look at your laboratory, start looking at your laboratory in terms of where do I need to improve the process?
Right. So I think one of the biggest things, so really two-prong approach. And I really genuinely mean two-prong. They both need to happen. One is that you're looking at data to kind of reflect maybe where those opportunities are, but you can't just sit in a room and look at data, right? It might be telling you a story, but you're not really getting the full picture. You have to observe. And it's so helpful to have your standard work on how that procedure is supposed to be done in a standard way, and really take a look at that and just watch how the CAP inspectors do it. They're watching to see if people are following the standard work that has been reviewed and approved by the laboratory. So if someone's like, hey, I want to take a look at maybe where these opportunities are, maybe where the error is occurring, I'm going to print out that standard work or open up a binder, however you're going to do it, and start watching people do the process and say, okay, maybe ask questions and say, hey, the next step is supposed to be this, but I was wondering, I didn't see you do that. And so can you tell me more about this? Not in an interrogation kind of way, but just asking questions. You're just trying to get an understanding of maybe where the process needs improvement. And so you really have to observe and ask questions, but you also need to use that data.
I totally agree. And when you're doing your observations, if you're a laboratory leader, if you're a lead tech or a supervisor or even an informal leader in your laboratory, a great place to dive deep into things that might be going um, outside of the standard work practice in your laboratory are the workarounds, because every laboratorian has them. Every we train our new people on what the workarounds are, and the workarounds are there because people are just trying to get their work done, right? They need to get things moving from point A to point B. They need to get the results out, but there's a
Mm-hmm.
process in the middle of the standard work that doesn't work correctly, and people have developed a workaround to that. And
Exactly.
if you can do your observations and start breaking down what these workarounds are, I think that would,
Yeah.
make a huge difference. And also talk to your staff on the front line. They know the
Mm-hmm.
things that would make their lives a lot easier. They're probably too busy to voice them or to try to
Yep.
fix them, but they understand, it would make our laboratory so much more efficient if X, Y, and Z would happen. And it's sometimes the smallest, most implementable, I made that up just now, actions that you can do. Um, do you want to try to walk us through how to develop and how to develop and implement a specific plan for improvement?
Sure. Yeah. So I would say, again, I'm a huge advocate for data. I'm a Lean Six Sigma Black Belt. I value data. I'm a super nerd when it comes to data. But again, we can't analyze data alone. And I think one piece of laboratory professionals, they're out there on the front lines. They're working as hard as they can with a lot of times, and I'm not enough resources, right? And so we want to have that respect for the people doing the work. And so what we don't want is for people to be in an office, not out there on the ground, working so hard to keep up with that volume. I don't want someone in an office to say, hey, these turnaround times are not meeting our goal. We need to make sure that we achieve it. Here's the turnaround time that we got today on this board. This is in red. We need to improve it. So that's not showing respect for the people that are doing the work. So again, please don't just analyze the data alone. We have to piece together the data with the observation. And again, just bringing about those lean principles of showing respect for those people who are doing the work, right? So talk with your team, ask questions, bring the data and say, hey, I haven't observed yet. This is just what I'm seeing, and just start jotting down potential waste that maybe you're observing, asking questions of people in the laboratory and say, hey, what are your biggest barriers through this process, are there errors that when you get to this step, these errors come up every time and you're spending so much time troubleshooting? Or also creating that psychologically safe environment where you can say, hey, I know that there are probably a lot of workarounds maybe happening. Can you talk to me more about those? Because I would like to think someone isn't going through those workarounds because they don't want excellent patient care and outcomes, right? They're doing it because they're trying to keep up. They're just trying to whip through those errors and keep up with the pace. So make sure that you create an environment where you can have that discussion, because it can be very scary for people to be watched. Maybe if a leader isn't as visible, it can be intimidating to have those leaders come out and start asking those questions. But make sure that when you ask those questions of the people on your team, that you follow up and have a transparent dialogue about what did you observe, and share the data that you've seen. So just remember that lean isn't a solo effort. You're not the one doing the work all the time. So let those who invest their whole days to the process take an active role in those improvements, and ask them what they think maybe some of the solutions are. Ask them about, how do you think what do you think is the best approach to this?
I totally agree. And if I could leave any listener that is out there with one specific point that has been helpful to me as a leader in the laboratory, it has definitely been exactly what Sarah is saying. Is there's so many aspects to implementing lean, but the most major fundamental one is creating a culture that is accepting and open. And I like what you said about, being psychologically open for your staff with lean, because when you're at a point in your laboratory where you're just trying to keep up with the pace and you're just trying to correct errors, and you just kind of get on this hamster wheel of, just trying to keep things going, you can never get to a point where you're truly looking at our processes and trying to, not just keep them going, but actually improve them for better quality of care. And you can't do that alone, obviously, but when you get to a point where you can involve your staff, and your staff feel open enough to bring forth things that they think would improve a process, even if it's not an ideal you can exactly implement, your staff feels open and willing enough in the culture that you've created to bring those things up. In our laboratory, we have a huge stoplight board hanging on the wall, and I've talked about this in some other conference sessions that we've had, and it's a lean tool that we use, and it's literally, a stoplight board, like green, yellow, and red, and the items that are green are things that are grassroots, they were brought forth by the staff, and they were things that we could implement right away.
Right.
We need more staplers at the hematology bench. We need another phone by the receiving area. These are things that make their lives easier on the bench, and it's easy for leadership, myself or my managers, my supervisors, to implement these things right away. And they're quick wins in terms of, you asked for this, we listened, we implemented, it's on the green side. The things in the yellow column are things that people have mentioned that are needed in the laboratory, that would help the workflow, but they're not easily implemented, right? So staff would be one of those things. We need more staff on the night shift. Okay,
Right.
We hear you, but it's not anything that I can snap my fingers and just put 10 more techs on the night shift. So it's something that we list, so you heard us, but we put, updates of where we are with implementing that thing. Maybe, validating a new test. We put updates every week of where we are with that thing, so it's still coming, but it's not going to happen overnight. And the items in red are the things that we heard you, we investigated, and unfortunately for these reasons, we can't, make these things happen. Windows in the microbiology area, the renovation would be $5 million, and that's not approved in our budget. At least when you're doing things like that, it's a visual for your staff that they are being heard, and it encourages them to bring forward more things, whether they're implemented or not. It encourages them to look for things even in the laboratory that need to be improved. And when you can get to that level, then you're truly on the road to improving processes, not just maintaining processes. Sarah, what is one point that you would leave our listeners with about lean today, or what they could do in their laboratory, or just one key point from our talk that we've had.
Oh, so many. But number one, respect for people. So if you push improvement on people, so you're a leader, you're thinking of, hey, what if we did this? And you push improvement on people, whether the data shows there's an opportunity or not. The effort is likely to fail before it begins. So don't be surprised about what people feel protective over when it comes to change. Maybe it's a binder of procedures, maybe it's a specific process or a step in a process. Either way, be respectful and work with them and be sure that you follow up with them like you did. And when you're soliciting that feedback, and maybe it's not possible to have windows in microbiology, right? But you're going to explain it, you're going to share it with your staff instead of just kind of leaving it in the air, and then people are just like, hey, I never heard about this again, right? They're going to lose trust a lot quicker if you don't follow up, even if it isn't the outcome that they want. It's a major thing. You want to build that trust with people. So make sure that you follow up and have respect for the people that are doing the work.
Absolutely. And, we really just touched on the tip of the iceberg. I mean, there's no way to really dive deep into everything that lean is and all that it can do in your laboratory in, the short time that we have in this podcast. And so I definitely encourage all of you, if you'd like more information, if you'd like to discuss things further, if you'd like to, reach out to either one of us and connect, definitely with Sarah, because she's got all the wonderful credentials. She's got an alphabet soup behind her name. Definitely reach out to us and we can help you, mentor you, answer any additional questions you have after you listen to this episode. So Sarah, can you let our listeners know, how can they best reach out to you outside of just hearing you on this podcast?
Yes. Please find me on LinkedIn. So I'd love to hear about your journey through Lean and Six Sigma in the laboratory, but also maybe some points of frustration or maybe where you feel like you're getting stuck in implementing some of those Lean tools and techniques. So please, LinkedIn is really where I hover most of the time.
And myself, you can always reach out to me on any of my social medias, Instagram, Twitter, LinkedIn at Stephanie Whitehead. Like we said, kind of in the middle of this podcast, there is nothing so useless of doing effectively that you shouldn't do at all. So we hope that we've encouraged you guys in this podcast to really take a look at your operations, take a look at your laboratory and see, where you can eliminate some waste, some redundant work, and improve your processes. Thank you, Sarah, for joining me today.
Thank you.
And thank you all for tuning in to another episode of the Elaborate Topics podcast with our special guest, Sarah Cook. Please leave a comment. We love to hear about what you have to say on this topic or maybe any other questions you have. Be sure to like this session today. If you like what you heard and you want to hear our previous shows or our previous season, make sure you subscribe at directimpactbroadcasting.com or on your favorite podcast platform so you don't miss any of our episodes. Remember to connect with us on our LinkedIn page. And like I said, connect with me on my social media. I love to hear from you, connect with you, and start a conversation with you. And please tune in next week to hear another amazing episode of the Elaborate Topics podcast. And until then, have a very good day.
Thank you for tuning in to another episode of Elaborate Topics, where your hosts discussed relevant strategies for laboratory professionals. Please subscribe to this podcast on your favorite podcast platform and listen to us on directimpactbroadcasting.com. Stay tuned for another episode with information you can use to excel in your laboratory career.